and today we're going to talk about bipolar disorder. Bipolar disorder is a common psychiatric disorder, which is at its heart a sleep disorder. Um, and that's the most interesting part about it to me, and the most important part about treatment. In bipolar disorder, there is a genetic problem that affects something called a fast sodium channel. A fast sodium channel is a switch in your brain that controls being awake or asleep. In a standard fast sodium channel, when it is open, then sodium ions can go through the channel, and that allows someone to be awake. When it's closed, that process stops, and so people are either awake or asleep. People who have bipolar disorder have three options: awake, asleep, and stuck halfway. If you're stuck halfway when you're awake, you lay down and you could be exhausted, but you can't shut off your mind races, and you tend to get more antsy, people become more anxious, they take more risks, oftentimes then they end up spending more money, having more sex, doing more drugs, gambling more, those sorts of things. Eventually, if you stay awake long enough, you can develop psychosis and those sorts of things. On the other hand, if you are stuck halfway in the sleep, no matter how much you sleep, you're still tired. You oftentimes feel withdrawn, want people to leave you alone, depression sets in. Um, People don't feel like they can fully wake up or concentrate. Oftentimes when they're asleep, they recognize that they're asleep, but they can still hear things in the room. They're aware of what's going on. And this also causes a lot of depressive symptoms. The interesting thing to me about bipolar disorder is that we can simulate all of these things by affecting people's sleep. In fact, there was a study that was done at Harvard a number of years ago where they had a sleep lab that they built a special bed that had a motorized rocking function on it, and then they put the patient in the bed with a EEG lead on their forehead that measures sleep. Now, sleep has four distinct phases. Phase 1 is light sleep, phase 2 is slightly deeper sleep, phase 3 is dream sleep, phase 4 is the deep restorative sleep. Whenever anybody moved from phase 1 to phase 2, they would gently begin rocking the bed until they moved them back to phase 1. By doing that, over the course of 3 days, everyone became profoundly depressed and hated the people who designed the experiment. And so what we can see is that being stuck in this not quite asleep, not quite awake state can cause anyone to feel depressed. The difference between someone who has bipolar and someone who does not is whether or not you need external stimuli to get there. But there are good treatments that can allow people to have a full night's sleep and therefore feel more normal. On the other side of the coin, if you have someone who stays awake long enough, people develop anxiety, jumpiness, they're more likely to spend things and do things, they look for more pleasurable responses, and ultimately if they stay awake long enough, they will become psychotic. One of my old medical students had been in the U.S. Army Special Forces, and as part of his training, they made him stay awake for 4 days straight. He explained to me that at the end of 4 days, he was having an argument with a dandelion about philosophy, and he knew it wasn't real, but he also knew that the dandelion was wrong. So anyone who stays awake long enough can have this happen. So what we see as well is that this chronic lack of sleep also has profound impacts on people's functions. In my experience treating bipolar disorder, if I can get people to be asleep at night and awake during the day, then everything else works better, and that helps them have much better function. In addition to that, studies show that good treatment with bipolar disorder will make you live longer. It reduces your risk of developing dementia. And early treatment also reduces the severity of the disease. Generally, what happens in bipolar is people begin to have problems with sleep and mood in their teens or 20s, and those become progressively worse until you hit about age 45, and then they start to get better. If we look at the rate at which things are getting worse without medication, and then we treat someone, we can lower that, and so people don't become as sick if they have early treatment. So early intervention allows you to have lower exposure to medication over the course of your life and treatment, as well as living longer and having less dementia. So not only are you alive longer, but you also know you're alive, an extra added benefit. If you think you may have this problem and you'd like to talk to me, I'd always be happy to see you in the office. I hope that you guys are having a good day. Thank you again, and goodbye.